Hello, welcome to Voice of Mzansi. Today's update is something that's sparking big debates across the country. Operation Dudula says denying healthcare to undocumented foreign nationals can help prevent crime. This is based on real events happening right here in South Africa. Stick around till the end to hear where the news came from and verify it for yourself. And if you're new here, don't forget to subscribe so you never miss a moment of what's happening in our country. In recent weeks, members of Operation Dudula have taken their campaign to clinics and hospitals in places like Johannesburg and Durban. Their goal is clear. They want people to show proof of legal status before being allowed medical help at public facilities. They believe that many undocumented foreigners are taking advantage of the healthcare system without contributing, and that this somehow creates a space where crime thrives. According to them, syndicates are getting access to chronic medication which is then sold illegally, and clinics are overwhelmed, leaving South African citizens to wait in longer queues or go without help. One of their leaders said that while emergency care should still be available to all, regular treatment, medicine collections, and consultations should be reserved for South Africans and documented individuals only. The campaign has gained support in some areas, with locals saying they've seen long queues and overcrowding in clinics where people can't even communicate with the nurses properly. Some say they've had to wait hours just to get basic medication, only to be turned away because supplies had run out. But not everyone agrees. The South African Human Rights Commission has strongly condemned the actions of Operation Dudula, calling them unconstitutional and unlawful. They reminded the public that Section 27 of the Constitution guarantees everyone in the country the right to health care, regardless of their nationality or documentation status. This includes access to emergency care, chronic medication, and maternal support. The SAHRC has called for investigations into the conduct of those turning people away at clinics, warning that such actions could lead to legal consequences. Health professionals have also weighed in. Doctors and nurses in affected clinics say turning people away can lead to dangerous outcomes, especially for pregnant women, children, and those living with chronic conditions like HIV or diabetes. One nurse from Durban said she understands the frustrations around resources, but she took an oath to help the sick, not to check passports. The Department of Health also released a statement condemning any citizen-led attempt to control access to health care. They said public services are for everyone who needs help, and that denying treatment based on nationality is both immoral and illegal. They've asked police and clinic managers to step in and make sure patients are protected. Despite this, Dudula members have vowed to continue what they call their civic duty. They say the Constitution protects the rights of South Africans first, and that their actions are a form of peaceful protest. They've also said they'll take their message to more cities, even if it means clashing with authorities or facing arrest. This whole situation has left many South Africans asking some hard questions. Can a country with limited resources afford to treat everyone, even if they're here illegally? Or do we risk losing our humanity when we start turning sick people away at the gate? Whatever your view, one thing's clear, this issue is far from over, and the courts may soon have to decide how far citizen groups can go before they cross the line. All images used in this video were just for illustration purposes. Our information comes from public statements by Operation Dudula, the South African Human Rights Commission, the Department of Health, eyewitness accounts from affected clinics, and verified reports shared by news organizations like News 24, IOL, Southern Live, and EWN. You're encouraged to check these sources and verify the facts for yourself. Thanks for watching Voice of Mzansi. Let us know in the comments what you think. Is denying healthcare to undocumented foreigners fair, or is it a step too far? And if you haven't already, hit that like button, share the video, and subscribe to stay informed on the stories that matter. And before we go, here's a little laugh. Why don't clinics ever play hide and seek? Because good health is nothing to hide. See you next time.